Thank you, Louise. I seem to recall performing that very same role at some of these events, including with a child in tow. And if it wasn't for Darren Chester's babysitting services, that event would never have got off the ground. Good evening, everyone. I begin, of course, by acknowledging the traditional owners. I pay my respects to the elders past and present and any other elders from other communities that may be here today. Of course, I acknowledge the Honourable Minister for Foreign Affairs, Julie Bishop, otherwise known as Boss, actually. Acknowledge too, Leader of the Opposition, Bill Shorten, Your Excellency, Charles Lapani, and any other members of the Diplomatic Corps, ministers, members, senators, guests, civil society, DFAC colleagues, etc. Thank you so much for the opportunity to be here. This is always one of my favourite events on the calendar. It's a wonderful opportunity to catch up with friends, former colleagues, and indeed showcase the work of the Burnet Institute, which of course holds a unique position in Australia, maybe indeed globally, of being a combined medical research and public health institute, as well as a DFAT accredited NGO working in resource-poor communities around our region. My work as Ambassador for Women and Girls is a natural fit, as you've said, Louise, with the work of the Burnet Institute. We know that gender inequality continues to have a negative impact on health outcomes around the world. Health programs that address gender inequities and inequalities leads to better development for all. Yes, it's that simple. Burnet has recognised this over many, many decades, but particularly for more than a decade in its work with PNG and tackling those health issues. Advancing gender equality and the empowerment of women and girls is, of course, a core priority of Australia's aid work, but particularly in Papua New Guinea. And we do this in a number of ways, whether it's advancing equal access to health and education opportunities, whether it's through increasing women's role in decision-making and leadership, increasing women's access to economic opportunities, or, of course, tackling by reducing or combating violence against women and girls. But as discussed at this event last year, successive Australian governments have been committed to maternal and child health in PNG, and you've heard a bit today about healthy mothers, healthy babies and the wonderful Burnet work there. But one of the things we've done to address the high rates of maternal mortality in PNG, Australia's increased the numbers of registered midwives. We've done it in a number of ways, whether it's through education, whether it's through scholarships, whether it's in actually forming a midwifery school. We've actually seen, and as of April this year, I believe, 315 midwives have been successfully registered. That's an increase of 128% over 3 years. And ladies and gentlemen, access to sexual and reproductive health services in remote areas of PNG is another focus. I've got to stop talking about babies, don't I, Louise? Because it just has this Pavlovian effect. But that's another focus of the aid work that we do in PNG. Last year, more than 55,000 women accessed rural outreach health services. More than 14,000 clients received long-acting or permanent family planning methods, and around 43,000 pregnant women were tested for HIV. So that's approximately 60% of women who are pregnant in PNG. We know that a sustained focus on gender to improve women's health we know that that's important, but it's something of which Burnet is acutely conscious of. This includes efforts to eliminate gender-based inequalities in education, income and employment, and of course, we must address the high levels of gender-based violence. The establishment of family and sexual violence units in 14 police stations across PNG has improved legal protection and support for the survivors of family and domestic violence. And Your Excellency, it was a great honour to open one of those units in the Baroko police station when I was there last year. And we've funded the training and appointment of female provincial magistrates to better address the needs of women in the judicial system. So, ladies and gentlemen, you know it from the work that you've heard about tonight, and it seems very simple, but we know that better health outcomes are the result of a coordinated and sustained effort across governments, across civil society and the private sector. I know that the Australian government greatly values its partnerships to promote health and empowerment of women and girls in PNG, but particularly in conjunction with the government of PNG and, of course, the Burnet Institute, which is one of the great medical research and public health institutes of our country. So tonight I congratulate Professor Brendan Crabb and his team. I'm sorry I'm no longer on the board, but doing similar work, just in a different arena. Congratulations to you all, congratulations to PNG, and thank you for the opportunity to speak tonight.